Good day, everyone. I'm Pooja Joshi, your host for today's episode. In this session, we focus on a condition that is common yet often misunderstood: irritable bowel syndrome, or IBS. To help us navigate this important topic, we are joined by Dr. Parth, MD, DRNB, at Wockhardt Hospital, Rajkot, a respected expert in functional gastrointestinal disorders. Today, Doctor will walk us through early symptom recognition, simplified diagnostic approaches, and effective evidence-based management strategies for IBS in routine clinical practice. Doctor, thank you for being with us. Let's begin our discussion.
Namaste everyone. Myself, Dr. Parth, Vadhadia, consultant gastroenterologist at Wockhardt Hospitals, Rajkot, Gujarat.
So, doctor, question for you is, what exactly is IBS? And how would you describe it in simple terms to a non-specialist?
IBS is a common functional gut disorders mainly affecting large bowel, which causes discomfort and affects the daily activities of an individual.
In your experience, how does a typical IBS patient present in an OPD?
Typical IBS patient usually presents with a cramp-like pained abdomen, which is associated with altered bowel habits, usually constipation, diarrhea, or both. And these symptoms fluctuate over a period of time, and they are usually chronic, more than 6 months.
What are the top 3 red flags that make you suspect IBS in a patient?
Top 3 red flags which we can say points towards IBS is chronicity of symptoms. It will be more than 6 months, as I mentioned earlier, and it should be associated with the change in bowel habits and pain abdomen. And the investigations or workup will be normal, whether it is a blood test, endoscopy, or any scanning. These tests will be normal. These things points towards IBS.
Are there any warning signs where a physician should immediately refer to a gastroenterologist?
Major warning signs associated with IBS are unexplained weight loss, persistent fever, and bleeding while passing stool is top 3 red signs which the physician should keep an eye on and refer to a gastroenterologist.
Once IBS is diagnosed, what is your first line approach to management?
First line of approach towards managing IBS is definitely changing the lifestyle, like focusing on adequate sleep, physical activity, and stress management, and change in the dietary modifications like adequate hydration and limiting irritant foods.
What's the role of diet? Do you recommend low FODMAP, fiber modification, or any particular dietary pattern?
Yes, definitely. I would prescribe low FODMAP diet in IBS patient, which basically comprises of less fermentable products and focusing on more soluble fiber intake like psyllium, oats, and reducing other irritant high FODMAP diet like caffeine, carbonated beverages are the main constituent which I would like to avoid.
What are some practical ways physicians can build patient trust in IBS treatment?
The best way to build trust in IBS patient is giving them adequate time to understand their questions, help them understand the gut-brain axis in a more simpler way, and to empathize with them and acknowledging that their symptoms are real, and avoiding unnecessary testing and further investigations is very important.
What advice do you give to patients for long-term gut health and relapse prevention?
Long-term gut health and to prevent relapse in IBS, I would like to give them the advice that focus on the relaxation techniques like mindful meditation, doing yoga, avoiding stress, identify particular food triggers which doesn't suit you and to eliminate them from your diet, and keep a regular follow-up with your gastroenterologist.
What's your vision for IBS management in India over the next few years?
The further vision to manage IBS better, according to me, is to involve psychiatrists, psychologists and work as a multidisciplinary team to manage IBS in a better way, developing early screening tools by incorporating artificial intelligence, and targeting newer therapies towards gut microbiome is the way forward to treat IBS better.
If you could give one takeaway to your fellow physicians about IBS, what would it be?
One key takeaway which I would like to give fellow physician is to avoid the fear and stigmata associated with IBS. It is definitely a manageable disease and not a dangerous one, and to avoid unnecessary investigations.
One food you tell IBS patients to avoid?
Food to be avoided in IBS patient is definitely onions and garlics are a big no.
One word that describes a typical IBS patient journey?
A typical Indian IBS patient journey is often exhaustive and sometimes frustrating. I would like to thank everyone for patiently listening to me and giving me this opportunity to educate you all regarding IBS. Thank you very much.
Thank you, Doctor, for sharing such valuable insights on IBS. Your clarity and practical guidance will certainly help both physicians and patients approach this condition with more confidence. To our listeners, thank you for joining us. Stay tuned for more expert-led conversations. Until then, take care and prioritize your gut health.